organizations from around the world who have supported progress in their national context through advocacy towards the 90-70-90 cervical cancer elimination targets. We're also going to be sharing UICC's latest advocacy resource, the Cervical Cancer Advocacy Handbook, which seeks to inspire and guide civil society organizations and patient groups on how to establish national coalitions and develop effective advocacy strategies in support of the elimination of the WHO's global strategy for cervical cancer elimination, and also including new recommendations that have been released since the launch of the strategy in 2020. This complements UICC's Breast Cancer Advocacy Handbook that was released at the end of 2024 and supports the implementation of the Global Breast Cancer Initiative. Both of these resources are available in English, French, and Spanish, and you can find them on our website, and the team would certainly be happy to talk you through them if you're interested to do so. So whilst I think many will be familiar with the cervical cancer elimination agenda, and those of you joining the call today, I want to briefly take you through the 3 targets outlined in the global strategy for elimination. First of all, 90% of girls fully vaccinated with the HPV vaccine by age 15 years. 70% of women screened with a high-performance test by age 35, and again by age 45. And finally, 90% of women identified with cervical disease receiving treatment, 90% of women with precancer treated, and 90% of women with invasive cancer managed. So these targets are to be achieved by 2030 in order to set each country on the road towards elimination. Now, to truly kick off this virtual dialogue today, I'm delighted to introduce Ulrika Arhed-Kagström. She's the president of UICC, Secretary General of the Swedish Cancer Society, board member of the Nordic Cancer Union, and a member of the Swedish government's Life Science Advisory Group. Her background is in finance, crisis management, and leading large and complex organizations in times of change. Ulrika is highly regarded for her extensive experience in strategic leadership and successful advocacy work. Ulrika, thank you so much for joining us today. And Sweden is a country that's making remarkable progress towards these elimination targets and aiming to reach elimination itself by 2027. I'd really be delighted if you could share with us a snapshot of Sweden's cervical cancer elimination journey and really the role that the Swedish Cancer Society has played in advancing advocacy work in Sweden.
Thank you for that introduction, Kirsten. So good to see so many familiar and new faces on this session. Really look forward to this discussion. And we have a beautiful morning here in Sweden today. It's a warm summer day, so you can see the light outside my window. We're not really used to that. Well, today I'm here in my capacity as Secretary General of the Swedish Cancer Society, and Sweden's road to elimination relies on 2 pillars, a strong prevention through vaccination, but also early detection thanks to screening. And in terms of timeline of the HPV vaccination in Sweden, since 2010, HPV vaccination is part of Sweden's general school immunization program, first for girls, and from 2020 also for boys. It didn't start like that. We had it through primary health care. It was those who had sort of well-informed parents and resourceful parents were started to be vaccinated. But a key to our success has really been the school-based vaccination. Administering the vaccine in schools has built trust through the school nurses who have access and who are trusted by all parents, and ensured a high coverage. And as for 2023, more than 90% of girls and boys took 1 dose of vaccine, and 87% of girls and 82% of boys were vaccinated with 2 doses. So we have a 2-dose system in our country. And in terms of the timeline for cervical cancer screening, in parallel, we built a robust screening system. Since the 1960s, cervical cancer screening has halved the number of cervical cancer cases in our country. And we're a country of 10 million inhabitants up in the northern part of Europe. And screening today is free and it's highly organized. So women between 23 and 64 receive regular invitations, increasingly with self-sampling HPV tests. which helps reach more women, and 3 out of 4 women participate, but still 1 out of 4 women doesn't participate in the screening program. So we must do better, especially among underserved groups, women born abroad, those in remote areas, and those with lower income or education levels. But to really accelerate elimination, we've been offering free catch-up vaccination till June this year to women born between 1994 and 1999. These women were too old to receive the vaccine in school, and the goal was really to reach 70% vaccination coverage in this group to achieve herd immunity and to eliminate cervical cancer by 2027. We didn't really reach this goal by the end of June, but we came very close. 65% of the target group took the vaccine, and several regions in our country reached the target on time. And we know that this catch-up vaccination will reduce the transmission of HPV by 90%, and we still have a good chance to eliminate cervical cancer by 2027. And the next phase of the elimination strategy is now to screen women with high risk of developing cervical cancer. And in our country, we're talking about a group of 300,000 women with incomplete screening who haven't participated in screening program and received any screening, or with detected HPV infections that haven't been followed up properly. So the goal is to make sure that these women are provided or offered HPV screening as soon as possible. And of course, to keep the high levels of coverage in terms of the school vaccination program. So the role of the Swedish Cancer Society, we've taken a really active role in the elimination strategy. For many years, we've financed research focused on cervical cancer screening and HPV. And we've really been active in the role of advocating for policy change and better access to vaccination and screening, no matter where you live or your background in our country. And in the sort of catch-up vaccination program, we've sort of organized a target group with research, with policymakers, with the public health sector, with our 21 autonomous regions, having weekly follow-ups on where we are. And it's really hard, even if we're a well-organized country, it's really hard, a lot of manual work to get the statistics on what's happening on the ground, really. So it's a challenge even in a high-income country like Sweden that's normally quite organized. And what we also do as a cancer society, we run public information campaigns targeting young women who qualify for catch-up vaccination. And we try creative approaches like vaccination as movie theaters, offering a free movie ticket to everyone who gets vaccinated. And this partnership with the biggest movie theater company in Sweden and a private healthcare provider has really been effective in terms of getting media attention, both traditional media and social media, to get the attention, to get them right about HPV and cervical cancer. But it also showed decision makers innovative approaches to reach a target group that you normally don't reach, because these are healthy young women who don't have cancer on their agenda. They live busy lives and they are not supposed to even have to think about cancer, but try to spread the information. And a lot of women got vaccinated in this quite innovative way. But we've also published a guide. It's also available in English, where we outline targeted measures to increase screening and vaccination rates among hard-to-reach populations. And it's been spread to decision makers in our country and abroad as well, but also to provide healthcare providers with tools that they can use at the local level. And we focus on trying to see what kind of intervention, give examples of intervention to reach different types of group, for example, women with disabilities, or women coming from abroad, or women in with different socioeconomic backgrounds. And we've identified barriers, expected impact of a certain intervention? Is it sort of high impact or low impact or medium impact? And also the resource intensity of this intervention. Is it really a costly intervention with a low impact, or is it quite a cheap and not resource intense intervention with quite a high impact? And also the level of evidence behind this intervention. For example, sending out invitations with appointments or working with doulas or culturally sensitive interpreters in specific groups to see what kind of resources are needed for intervention like that. What's their impact and what's the evidence behind this? And we try to also work with multiple stakeholders, healthcare professionals, researchers, NGOs, national agencies, and companies, private sector partners in this effort. And despite our progress, challenges remain. There are huge regional inequities in Sweden, not all counties reaching target vaccination or screening rates. And we also observe equity gaps, especially with women in socioeconomically disadvantaged groups in remote areas, those born abroad, individuals with disabilities are less likely to be reached by current systems. And looking ahead, the Swedish Cancer Society, we continue to advocate for expanding catch-up vaccinations to additional groups, including individuals at high risk, to further accelerate the elimination of cervical cancer, but also to prevent other HPV-related cancers. And the Swedish Health Agency is now recommending catch-up vaccination for both men and women up to the age of 27. And some of the takeaways and conclusions from the Swedish Cancer Society and this strategy is, I'd give 4 sort of conclusions or takeaways. First, gender-neutral school-based vaccination works. It builds trust, it ensures high uptake, and it's really an equity issue. And number 2, screening saves lives, especially when paired with reminders, self-sampling, and easy access. And 3, equity matters. Reaching underserved populations requires tailored solutions, not just blanket policies. And 4, we must keep innovating since creativity helps us reach more population. And some examples might seem silly, but we still need to be creative to reach these specific target groups. So if we continue along this path, I'm sure that we will reach the elimination target. And I think also some of the experience in my country, because so many say that, well, you're a high income country, you're so organized. But vaccination and screening is the responsibility of our 21 autonomous regions. So the government can't really decide what the regions are supposed to do. So it takes a long time to have something implemented that you want to decide on the government level. And so a lot of the decisions can't be taken by the government. So we needed to really reach the parliament to work with all political parties, to have the parliament to take a decision. And in our case, it wasn't really about the money, the funding. It was about taking a decision that get all parties on board, which is a different situation than in many other countries. But still, most countries have disorganized health systems, and it's challenging with different levels in your country deciding and having the sort of the decision over different decisions. But we need to overcome that. And I think key to our success has been us working together, research, patient advocates, policymakers, building the case for this and saying that, well, if we want to eliminate cervical cancer with disorganized vaccination, we will never reach the target. We can reach it later with sort of effective vaccination, but only among children and not working to reach all women in terms of our screening program. But if we really want to eliminate cervical cancer now, we need to have school-based vaccination, catch-up vaccination, and see to that all women are reached by screening programs and are followed up. So it's really a matter of what you want to achieve in your country and to build the case for that. So thank you so far.
Thank you, Ulrika, and thank you so much. I mean, it's so interesting to hear all these different insights, so many valuable points kind of mentioned there around, the importance of equity and reaching those different regions of Sweden. As you say, it's a high income country, and many may assume that that eliminates many of the challenges. But thank you so much for highlighting those issues of equity in populations and in terms of geography, and then also in terms of the collaboration and partnership creativity, as you mentioned. It's great to hear some of those efforts that the Swedish Cancer Society has been involved in. If you do have any questions for Rika, please do put them in the chat. We'll have an opportunity for Q&A at the end. We're going to move very quickly to the next part of our virtual dialogue. And really, I'm pleased to invite Rosanne Lamplow, who's a member of my team working at UICC. So she's the Senior Manager in Capacity Building here. And she leads the Cancer Advocates Program, supporting civil society organizations in their national advocacy efforts, and also is really working on UIC's people-centered care initiatives. So collaborating very closely with UIC member organizations and a dedicated expert working group, she's played a key role in developing the Cervical Cancer Advocacy Handbook. And we'd like to just take the opportunity to talk you through the handbook and to really showcase and share how you can use it, and hopefully it'll be a valuable resource for you all. So Rosanne, I'll hand over to you.
Thank you, Kirsty. I'm gonna just share my screen. Yeah, I think everyone can see that. So as Kirsty said, I'm going to speak to the Cervical Cancer Advocacy Handbook that we released earlier this year. So the Cervical Cancer Handbook, as Kirsty said, was developed really to support civil society organizations and coalitions in their advocacy efforts to advance cervical cancer prevention, screening, and treatment aligned with the WHO Global Strategy. It was co-developed with experts and representatives as well from the cervical cancer community. So we had a working group, and then we also had a consultation process to see how well this aligned with the UACC community and kind of the needs of the community in terms of advocating for cervical cancer elimination. It does draw on insights from UICC's Cancer Advocates programs, and we've included some successful case studies from UICC members who have also joined this call today to be able to share their experience as well. And as Kirsty said, it's available in English, French, and Spanish. So when we talk about cervical cancer advocacy or advocacy in general, we're really talking about this strategic process of influencing governments and decision makers and other key partners. So with the aim of developing commitments, plans, and policies, and allocating resources as well needed to drive change. And we recognize, as I think many of us do, that civil society organizations really have a critical role to play in this advocacy process. So kind of working on advocating for change, but also holding governments accountable as well for any changes made. So the handbook, we kind of have divided it, I guess, into three kind of key pieces. So one is around coalition building, so thinking about as a first step to advocacy, so thinking about key partners and competencies needed within a coalition to inform advocacy strategies and mobilize action as well. And then the kind of core part of the handbook is around the advocacy strategy. So here we kind of take a bit of a deep dive into understanding the socio-political national context, and then identifying which advocacy angle to use. So recognizing that there's not a one size fits all, but it really depends on kind of the political will that you might have in country, the progress that might have been made, and then finding what the niche role of civil society organizations is in terms of advocating for change. And then for our final piece, we're looking at the advocacy messaging. So how to develop robust messaging, how to leverage key dates as well for the best kind of opportunities to get your message across. And then we have a really nice example of a successful advocacy campaign as well. So here we have on the right-hand side is a bit of this socio-political context that I was talking about. So within the handbook, we go into a little bit more detail, but basically we have this quadrant of high political will to low political will and slow progress to promising progress. And CSOs can kind of identify where their country might be in terms of implementation stage, sustaining momentum, national drive, or leveraging progress. And then based on that, we have some different recommendations aligned to each of the targets in the WHO global strategy as well. So this is just one example on the first target around primary prevention, so looking at HPV vaccination. If your country has low political will and slow progress, then you would be in this bottom left quadrant in the national drive stage. So then, for example, you might be in a context where there's no national HPV immunization program. So your advocacy efforts could focus on integrating HPV vaccination into national plans for girls 9 to 14 years using a single dose schedule. So we talk about how establishing a law could help to include HPV vaccination in the national immunization schedule to ensure long-term availability and government support. So as you use the handbook, you would see that there's these different kind of examples for each of the targets. So it's really about, as I mentioned, it's really about translating the WHO global strategy into effective national advocacy. So the goal is to equip advocates with the knowledge and resources necessary to effectively raise awareness. So kind of throughout the handbook, there's different ideas that we have and different resources kind of jotted through. And then at the end, you have 2 pages full of resources and links to resources that hopefully would be useful for your advocacy work as well. We offer ideas for whom to engage in advocacy efforts. So this can be both in terms of the coalition members you might want to engage, but also in terms of policymakers and communities that you might think about engaging as well in your work or reaching out to. And then, as I mentioned, it really provides this guidance, kind of step-by-step guidance on how to focus advocacy efforts to support cervical cancer. And then, as we've already mentioned too, it's highlighting successful advocacy campaigns. We're really excited to feature some of UICC members in the handbook as well. And then just to kind of support your work, I've included here, and my colleague Niso can share some links in the chats as well. Some extra materials that might be useful to you. These are also featured in the handbook, but we have a coalition building toolkit with kind of exercises and some key examples to guide you through the idea of building a coalition as well. Similarly, we have an advocacy toolkit, again, quite a comprehensive material with step-by-step guidance to design and implement effective advocacy strategies. And then we have some more stories from our UICC members about their work in advocacy. And then we also have an Advocacy for Improved Cancer Control course. So we run this course on an annual basis as a kind of live course where you can follow along with a cohort of participants, and we have some sessions as well that we run with you, or you can access it on demand. So that course is available on UICC Connect. And then we also have some complementary cervical cancer materials as well. So similarly, we have another course on UICC Connect, which is a foundational course which really introduces cervical cancer groups to the WHO global strategy and the 90-70-90 targets that Kirsty mentioned. We also have a resources page with infographics, social media messages, some reports, and other relevant materials for you. And then on UACC Connect as well, we have a cervical cancer elimination room. So this is really a space for professionals in the field to connect, collaborate, share insights, and support one another. So as I said, Niso will be sharing links in the chat. So we do encourage you to go visit UACC Connect and check out some of those materials. And that is it from me. And I'm happy to answer any questions in the chat or afterwards.
Thank you so much, Roseanne. Hopefully that is a helpful resource to you. Please do follow up with us if you have questions, reach out to the team. And I'd just particularly like to highlight UIC Connect, which was mentioned a few times there. This is our global community platform. It is a resource and a place for you. It is intended to be a member-led platform. Please discover it, explore it. There's online courses on there. There's different conversations going on. We are growing and developing it based on the feedback we're receiving from members. So please also share your feedback with the team. It's really intended to be a space where you can access information, ask questions, connect with other members, and learn from different experiences. So really on that point, the next part of our virtual dialogue today will be featuring 2 UIC member organizations who have shared their stories in the handbook And we really wanted the opportunity to discuss it in a little bit more depth with them. There's some fantastic stories, fantastic organizations. And these two case studies that I mentioned, they're in the handbook. You can see them on the screen there. So for this panel, we're really going to show you some strategies and successes from civil society, building on that which Ulrika has already shared. And I'm really delighted to welcome two UIC members from Malawi and New Zealand, so two other different contexts in the world to share their experiences. So first of all, I'd like to introduce Maud Mwakansungula. She's the Executive Director of Wukaka. So Maud is a leading health advocate focusing on women's reproductive cancers, particularly breast and cervical cancer, and broader sexual and reproductive health and rights and NCDs. As the Executive Director of the Women's Coalition Against Cancer in Malawi, she champions equitable access to reproductive cancers and NCD care for marginalized rural women and girls. Maud has been instrumental in advancing national efforts for cancer prevention, treatment, and patient care, and she also chairs the Malawi NCD Alliance. So welcome, Maud. I'd also like to introduce Emma Shields, Evidence and Insights Leads from the Cancer Society of New Zealand. So Emma is in the Advocacy and Public Affairs team at the Cancer Society of New Zealand. She's a public health dietitian by background and has been working in cancer control for almost 10 years, both in New Zealand and in the UK. Emma's work at the Cancer Society sees her advocate for evidence-based policies across the cancer control continuum, but largely focused on tobacco, alcohol, food, and cervical cancer elimination. So welcome, Emma. Thank you, Niso. Hopefully we still have Maud on the line. I know there were a few connection issues, but perhaps we'll kick off with Emma while we're reconnecting with Maud. So New Zealand's making great progress. I know that New Zealand is very keen to kind of benchmark their progress against Australia, which is another kind of leading country in terms of cervical cancer elimination. And the society was featured in the handbook as an illustrative example of evidence-based advocacy messaging in the form of an open letter urging the health minister in New Zealand to take action. And you also launched a campaign inviting New Zealanders to help write the book on defeating cervical cancer, highlighting the voices of people with lived experience. It'd be great if you could just share a few insights about the campaign and some tips, principles, and strategies that you've put in place and how to develop that effective advocacy messaging.
Yes, well, thank you so much to UICC for spotlighting our work and for having me along to speak tonight. It is a cold winter's evening in New Zealand, like in Sweden, but it's a privilege to be here today and to be connected to this global community. So yes, here at the Cancer Society of New Zealand, together with three of our critical NGO and academic partners, we have been actively campaigning for action to eliminate cervical cancer for about a year now. So we launched our public awareness campaign in the form of this digital book, inviting people to sign their name and share their story, calling on our government to invest in developing and implementing an elimination strategy in New Zealand. So to date, we've collected nearly 4,000 signatures and we've had hundreds of people impacted by cervical cancer share their story with us. We've received some great media coverage and we've also been doing some direct lobbying and engagement with our Ministry of Health. And we're just working up our plans about how we will hand our final book to the government to show them this public support for this goal. So in terms of advocacy messaging frameworks that I personally find really helpful and one that we've used across our campaigning is the Vision Barrier Action Framework, which you may or may not have heard of. It's one way to help build public support for your policy issues. So firstly, outlining what your vision is. And I think in this case, it's a really easy one. You know, we've got this amazing positive story, achieving equitable elimination of a cancer in New Zealand and globally, creating this future where almost no one dies from this preventable disease. So next step in this framework is what are the barriers to achieving your vision? So in terms of the New Zealand context, we have had some really great progress in recent years. We have had the switch to HPV primary screening and an option to self-test in our National Cervical Screening Program, which is an absolute game changer. We're already starting to see some of the impact of that. but we're still nowhere near meeting the WHO 2030 targets, particularly for vaccination rates. Our vaccination rates are really low. We're hovering about 50%, and we've got lots of inequities, like you mentioned in Sweden, in access to vaccinations and screening in New Zealand too. So we really see a lack of funding and a lack of investment and a lack of a national coordinated strategy as a big barrier to achieving our goal or our vision. And then finally, what are the actions to overcoming your barriers? So as we point out in our messaging, we have all the tools we need. We have vaccination, we have screening. We just need the government to invest in implementing them effectively so that they can reach everyone. So particularly a national dedicated strategy with dedicated funding for implementation is what we would like to see. And one of the key things with this framework is that the barriers you raise in your advocacy messaging, they kind of can't be insurmountable barriers, but they must be believable barriers. And then the actions that you highlight should address the barriers to help you achieve your vision. So that's one framework that I personally find really helpful. And then in terms of other messaging tips, which aren't particularly revolutionary, but working with experts and researchers to help you ground your messaging in the evidence, of course. We're really lucky to work with a really great comms team at the Cancer Society and have that great partnership. And then using plain language wherever possible, whoever your audience is, whether it's the health minister or the general public. I think plain language always matters in messaging. So yeah, thank you.
Thank you, Emma. And again, just I want to pick up on that point around collaboration and partnerships, particularly in the context you've just mentioned about research. I think it's a really valuable point. We've heard it also from other UIC member organizations working in different topics of how valuable that those partnerships can be to provide that evidence for effective advocacy, even if the organizations, civil society organizations don't have that expertise themselves, that there's a real opportunity there for us to collaborate together. I just wondered if you could, I know this remains a kind of very active advocacy priority for the Cancer Society, and its advocacy is not a linear process and can take many, many years. So I just wondered if you could share a little bit about kind of what's planned going forward. Obviously, you mentioned that you're going to be presenting this book to the Parliament. And it would be great, yeah, just to kind of outline those kind of future steps.
Yeah, I mean, absolutely. I think advocacy is a pretty tough gig at times, and our journey has certainly not been linear or gone to planned timelines. We've had to constantly adapt and evaluate, and it is still very much a live issue for us. We don't have our national elimination strategy, and we don't have dedicated funding or a significant investment yet. So yeah, we've had lots of challenges with our campaigning. I think firstly, obviously it is a busy world and there's lots going on both nationally and globally, so it can be really hard to get cut through. So for example, with our public campaigning, when we launched it initially, we launched it around the same time, coincidentally, with a bill that had been launched concerning our foundational treaty here in New Zealand, which rightfully so received a lot of media and public attention, and was potentially one reason, and definitely not the only, but why we didn't get as kind of as many sign-ups in that very early stage. So we've had to extend our campaign timelines a lot longer than we ever imagined. And we also pivoted to take this digital campaign into community. So particularly leveraging our Cancer Society fundraising events, we took the digital book to community to have conversations with public and encourage sign-ups that way, which actually was a really, really effective way to build the support and have those conversations in community. And then the other thing that happened with us in the last year is at the start of this year, we also had a change in our health minister, which meant that all of the lobbying and the priming of our previous minister that we had done last year became redundant, and we've had to start again with this new minister who obviously has his own agenda, priorities, particularly like most health systems, we've got a lot of workforce challenges, hospital challenges. So again, trying to get these prevention agendas really tricky. So again, that's really pushed out our timelines in many ways. And just to touch on some of the advice that I was reflecting on is for other advocates, and it's again not very revolutionary, but being prepared for things not to go to your ideal timeline. I think that's the only thing you can rely on in advocacy, and being comfortable with that and prepared to adjust and adapt and evolve, because you just have to. And with that, bringing involves patience and being aware of burnout, being aware of boredom in terms of media and public, and just reminding yourself as advocates, and I'm having to do that currently as well. And then you're working in partnership, like you mentioned, Kirsty, is so valuable. So many benefits that we've experienced and others have as well. It can help you amplify your message, pool resources, share the load. It can help you be a really trusted source if you're all saying similar things. And your partners, like you mentioned, can help fill gaps in expertise or knowledge, particularly for media. We've relied on partners for that. And I think it can bring challenges around coordination, compromising on messages at times. You might need additional time to get things approved, but all of the benefits, I think, outweigh those challenges. And then, having really clear call to actions and key messages, I think, is really critical in advocacy. Having really specific policy solutions so that you can communicate that to public media decision makers. So I've mentioned our specific overarching one is this dedicated strategy with funding to implement it, but other ones we've got around like a fully funded cervical screening program. Unlike in Sweden, ours is not fully funded, and the funding that we do have is not sustained. So that's a huge issue for us. And then just finally having those champions and messengers who can tell a really amazing story. And we've had an amazing partnership with Professor Bev Lawton, who's an amazing researcher and advocate in New Zealand, and recently won New Zealander of the Year, and has had this amazing platform and tells an amazing story. And then, of course, all of the everyday New Zealanders have shared their story as well. So yes, very much still a live issue for us, and we are working on building that relationship with our new minister to hand the book to, and we're really hoping that we will start to see some real movement. So yeah, thank you so much.
Thank you so
again.
much, Emma. No, thank you. And it's always inspiring to hear just the incredible resilience of the cancer community to keep overcoming these kind of challenges that come up. The ones you spoke about, I'm sure, are shared by many in the community, changes in the political dynamics, in the health minister, shifting timelines, and really is just a reminder of that the need to adapt and continue to persevere. And it's really through the incredible efforts of the cancer community. So thank you for sharing your story today. There may be some other questions, so I'll come back to you. But I think we now have Maud back online, and I'm not sure she'll be able to have her video on because of connection, but it's really great to have her with us today. So Malawi is one of the countries with the second highest mortality rate linked to cervical cancer globally. Maud, I think you can hear me. Yes, I see you. I see you online. So Wakaka has played an absolutely pivotal role in Malawi's HPV vaccine rollout, as featured in the handbook. And you've really built partnerships and trust in country. It'd be great if you could share just some of the key strategies that have helped you successfully engage government, healthcare providers, and communities in your context.
Oh, thank you very much, Kirsty. Sorry about that. I've got a bit of a problem with connectivity. So if the video is compromising, I'll be able to switch it off, but right now I'll be using it. Okay, we'll talk about Malawi, Women's Coalition Against Cancer, which was part of the rollout of the HPV vaccine in 2019. But not only Women Coalition Against Cancer, there were quite a number of organizations from the cervical cancer space, from the general cancer space, also from human rights. There were different organizations which were actually part of this rollout. So mine is just to talk about the strategies that we used to be part of this important rollout of the HPV vaccine. Initially, I think it's very important that you should be registered with the relevant bodies in the country, which gives us legitimacy to sit at the table to be able to negotiate and talk about issues on cervical cancer. So Women's Coalition Against Cancer is actually registered with NGO Regulatory Authority, as well as the council NGO. There's a council which actually registers us also organizations, NGO organizations. So that was quite important for us. That was one of the strategies to make sure that when we're going to the table to talk about the HPV rollout, we are actually registered. And then the second one is to ensure that we build strong coalition partnerships. One of them which we built from the beginning as we started our work was with the Ministry of Health. We would do simple projects, even volunteer projects, but would keep them updated. Not the headquarters as such, but even just as we're working in the districts which we're working with, we'll be able to engage the district hospitals on what we're doing. So that was something which was very important. So it's important just to make sure that you build these relationships at local level, at district level, even at when it even comes to the MHO headquarters itself. So that was quite crucial for us. The other thing was actually making sure that we belong to the umbrella group, which is the Cancer Association of Malawi. So we're registered with them. So being registered with them was very important because they're the ones who actually recommended us to now join. They recommended us to the task force on the national task force, which was doing the HPV vaccination. So that was very crucial. So it's also important that we belong to that group. And then there was a part where we were working with healthcare providers from when we started our organization. So this was also something which was quite easier for us to be part of the task force on the rollout on the HPV vaccine. So we worked with the health workers, and it was also easier for us to go out there when we had gotten all this training to now start talking about the benefits of the vaccine itself. The other thing is on building strong coalitions is the community leaders. We were able to work with the community leaders because that's what we were doing before when we were doing the cervical cancer screening. So we also engaged them a lot on when it came to the HPV vaccine. It's also important, another strategy is that community mobilization and awareness programs. We were utilizing existing grassroots networks to reach women and girls in both urban and rural areas so that they are made aware of the information on HPV vaccine. And we had targeted education, developing and disseminating culturally appropriate, accessible information about HPV and cervical cancer. So that's what was done. And we also had a lot of community meetings and campaigns with communities themselves, organizing events, workshops, and awareness campaigns directly with the community, as I said. And if they had questions, they would ask them and then we would build their confidence. Apart from that, we also made sure that we had people with lived experience who could actually help us out in this campaign itself. So we're focusing on patient support, and it also demonstrated that it was quite tangible. It had a tangible impact of cervical cancer to motivate communities to ensure that they send their girls to have their daughters vaccinated by the HPV. It's also necessary as we're going to the table that we should also have evidence-based advocacy. That means getting information from what the policies are, what is the situation of the cervical cancer on the ground. But also at the same time, we should be able to see, we should be presenting solutions, ensuring that we position the HPV vaccine as a key, as effective and preventable solution to the public. So that's all what we're doing. At the same time, we're also leveraging expertise and grassroots insight to influence national policies. So this is what we're able to do when it came to, we should have evidence-based advocacy. So we had to have all this data, all this information to ensure that when we're engaging the policymakers as they're inviting us to the table, we should also know what we're talking about. At the same time, we're also looking at, we're trying to address barriers to uptake. So what information gap was there? We had to make sure we had that kind of information that we're able to fill that gap. Ensuring that there's accessibility to all who wanted to have the HPV vaccine. It was also necessary, and also at the same time addressing stigma. So these are some of the strategies which Women Coalition Against Cancer used, but also together with other CSOs in the same space. Thank you.
Thank you, Maud. And again, just Yeah, I'm always just blown away. Just it's so fantastic to hear from UIC member organizations and to hear the richness of the experience. And I'm sure many others are inspired by the stories and strategies you've shared. I mean, just picking up on some of the ones that haven't been highlighted so far today, but this piece about being registered and having that credibility with the right, helping to have that credibility with the right organizations. I think that is something we haven't touched upon. I think is a really valid and valuable point. Also, this engagement of community leaders. I know from some of the work of UIC members in Francophone Africa how important that is to engage community leaders as the kind of gatekeepers, both in terms of addressing stigma, but also in terms of the advocacy piece. And then equally, I like the fact how you've touched upon these multiple roles of civil society organizations. I think that's one of the strengths also is that civil society organizations bring such in-depth kind of knowledge of communities. So they work across the kind of awareness raising, community mobilization, and also the advocacy. And that just brings us such a richness to the work that you're doing. I wondered, you've obviously shared many kind of strategies already that would be useful for other organizations. I just wondered if you could touch upon any other kind of practical tips that you would give to other civil society organizations looking to strengthen their advocacy efforts for cervical cancer elimination, and particularly in these contexts where resources for cervical cancer programs may be quite limited.
Yeah, thank you very much, Kirsty. Mostly, I think it's avoiding, one of the lessons I've learned is avoiding to work in silos. You can't do it alone. It would be best with limited resources that we should be able to work together. Bringing in different players at the same time and using the same resources is something which is actually recommendable because you leverage on those kind of partnerships. Like in our case, we worked a lot with faith-based organizations, women group, youth-led initiatives in the communities as well as nationally. So that really helped. So resources could be shared, and then the voice of many is something which is quite it's very easy to move policymakers rather than going it alone. So as I said, Women Coalition Against Cancer was part of the task force, but we are not the only ones. There were quite a number of us. And we went all the way to the actual implementation of the rollout where we invited the whole way. So that is quite important. Identifying key stakeholders is also very important. You should map out relevant actors, policymakers, who you're going to work with. That's quite important as well. So it is something that I think when it comes to limited resources, that is one of the best things we could do together. One of them again is community engagement and mobilization. We should use grassroots powers. As we empower them, they're able to bring quite a lot to the table. This includes just educating women and girls, and even in our case, mostly we're educating the men who have the upper role in the families on what they should actually do when it comes to their daughters. Yeah, so that was one of them. Just also to encourage other CSOs that we should align our work to the WHO global strategy, which is on the 90-70-90. And also look at national health plans, because at times we just start our work without looking at what policies are already in place. So let's make sure that we go, we manage to get in touch with the Ministry of Health, look at what health plans they have. If there is need for improvement on their policies, that is something that we could also go and advocate about. But just looking at the national health plans and knowing what you can look at and see what is already there before you start your advocacy. So I think those will be the two. Thank you.
Thank you, Maud. Yeah, absolutely. This point, the voice of many, I think that's a lovely phrase. And I certainly in the handbook that Roseanne presented earlier, the coalition building is really the starting point. And thank you for highlighting some of those organizations that you're working with. And I think actually, Emma, you also touched on this point as well, the absolute fundamental importance of a national cancer control plan and national elimination strategy to support sustained efforts. I'm very conscious of time. I'm trying to pick up on some of the questions in the chat. There was a question asked around, is there any intent to link the advocacy efforts or to synergize with other campaigns or resources with a link shared? I just wanted to highlight that is certainly something that UICC is looking to do. We are a membership organization. We are here for our members, and we're really looking to facilitate the learning across members, as you see in this virtual dialogue today, but in so many aspects of our work. UICC Connect is certainly this place to share resources that you're aware of from other organizations. We're definitely trying to connect with other organizations we're aware of to make sure we're not duplicating efforts. But this is really, UICC Connect is really a great place to be sharing some of the resources that you're available, that you know of that are available. And hopefully that will help us to streamline our collective efforts as a community, because even in every context, I think there are limited resources, and certainly we want to make sure we're working as effectively as possible across the community. I saw another hand up as well, although I can't see it now. Sorry, I'm just scanning the chat. There was a question here, maybe Ulrika, I can come to you. There was a question around vaccination of older girls, older women. And I just wondered if you would be happy to take that question.
Yes, I mean, that's why we're doing the catch-up vaccination, not only in Sweden, but in other countries too. But up to a certain age, that is sort of, you can find that it's a good value. And in our country, they've decided that up to the age of 27 is a good age. Of course, you can take the vaccine, but it's not reimbursed or anything. It's really expensive if you want to do that as an older woman, and it doesn't really have the effect that for young women, for girls and young women and young men.
Thank you, Ulrika. I'd like to thank all the speakers for sharing their insights. There's been so much rich content shared, and I'm sure I could speak to all of you for a lot longer and ask you many, many more questions. Ulrika, I wonder if you'd just like to give a few kind of closing remarks before I kind of wrap up the session today.
Yes, I see a question now. What was the most significant factor to enable cervical cancer screening to be fully funded? It's not fully funded. I think what we saw, because in the beginning in our country, it was not fully funded, and it was not for free. It was, you had to pay to go to your screening. And of course, then we saw the huge inequity gaps. Women who had better education, better income, were more well informed, were the ones who participated in the screening program. So in terms of having an equitable health system and aiming for equitable health for everyone living in our country, it was important to see that it was fully funded. But it took many, many years. And looking now at the current new sort of screening programs that are implemented in our country, for example, colorectal cancer screening, one region started like in 1 year, and it's going to take 14 years until all the regions have implemented that, a new screening program that is fully funded. But it takes time and it's complicated, but it's an equity issue. So that's the argumentation for that. Even though there's still discussions within the country which sort of level in the administration should pay for it. And the catch-up vaccination program, it's paid for at the national level, even though it's distributed at the regional and local level. So it's a bit complex and complicated, as in all countries, and we all have our different systems. And to wrap up, I think it was so interesting listening to Emma and Maud, but what really resonated with me was sort of the togetherness of it, that we need to present many voices and we can't do it on our own. We need to work. And this is a great example, the Advocacy Handbook, the meeting we're having here today, what all that's happening within the the UICC among members and WHO, and how we're working within countries on the community level, regional level, national level, and global level to really reach this objective of eliminating cervical cancer. So that really is something we need to remind ourselves of. And I also think, because in terms of working with advocacy, I worked with advocacy for so many, many years, and it's always changing governments, changing new political agendas. So you have really to be stubborn and sustainable in your work and sort of forceful in and also it's so important to care for monitor progress all the time and not give up and follow, monitor progress, engage different stakeholders and present solutions and focus on sort of one or two easy solutions for politicians. And then we know that there are 20, 30, 100 details that we need to figure out after that. But we need to present quite easy cases for politicians and building on evidence, but also patient and people with lived experience. But this meeting actually makes me more convinced that no matter how challenging it may be in some context, for example, the Malawi context, I see also the progress you're doing and moving forward, and it's really encouraging. So I'm just very optimistic and glad now, and I think we really have a good chance to eliminate cervical cancer in a very near future. So thank you.
Thank you, Ulrika, for those closing remarks. Yeah, fully agree. The recording will be available. I think we're missing just the first couple of minutes of the recording, but I would certainly encourage you to listen back, to listen to some of those strategies shared by the different UIC members present on the call. Thank you so much for joining. Thank you to all the speakers. Really fantastic to speak with you today. And yes, please do connect with us, reach out to us, ask us any questions. Yeah, it's an absolute pleasure to speak with you today. Thank you very much.